So for melanoma patients, which symptoms or immune-related adverse events would you like to highlight? As a patient in the melanoma setting, you have the great advantage of having a group of healthcare providers who have been working with immunotherapies for several years, since melanoma was one of the early adopters. So that's really wonderful in terms of education regarding immune-related adverse events. However, when we start talking about these immune-related adverse events in the adjuvant setting, which is the setting where you have no evidence of disease, but we are trying to prevent a recurrence, that can be a difficult conversation because the risk-benefit analysis is a bit different than in the metastatic setting where you have measurable disease. So, for example, one of the more common immune-related adverse events that we see is endocrinopathies, and this may include things like thyroiditis, where your thyroid function is low or high, or hypophysitis, where your pituitary function is altered, or even diabetes, you have less of an ability to regulate your blood sugars. So these endocrinopathies are things that in the metastatic setting we have seen may not be reversible. If a patient develops a type 1 diabetes, they're likely a diabetic for life. Same if they become hypothyroid, they're likely on a thyroid replacement for life. So again, in the metastatic setting, that may be okay with a patient. However, in the adjuvant setting, that may be much less tolerable. And so you really need to consider your goals with adjuvant therapy and what's important for your general quality of life, and have those really thorough conversations with your healthcare providers. Ask them all of these questions and understand what's the benefit and what's the risk and what are my alternatives.